Hey, welcome back to Not So Complicated. And today we'll be talking about the side effects of metformin, the most commonly used drugs these days because of the rising diabetic patients, right? So it is an euglycemic drug, but it has a very much of side effects that you need to know. And actually, the metformin it inhibits intestinal glucose absorption, and thus it alters gut microbiota, right? So that will lead to an increase in lactic acid and gas, thus GI disturbances or gastrointestinal disturbances, and these get manifested by various ways. One of them is nausea or dizziness, and loose stools or diarrhea can happen, and also you can experience bloating, right? And also you can experience abdominal cramps. So GI disturbances is the most common side effect of metformin, and in rare cases, what happens is that metformin inhibits mitochondrial respiratory chain complex 1, and that will lead to increase in anaerobic metabolism and thus lactic accumulation. So lactic acid accumulation will lead to lactic acidosis, right? And this also get manifested by various ways. The first one of them is weakness, and it manifests as rapid breathing also, and confusion due to acidosis, right? So Kussmaul's breathing or hyperventilation can happen due to lactic acidosis also. That is a reflex or compensatory mechanism. And in chronic metformin use, you have to consider like vitamin B12 thing. So it interferes with B12 absorption in the ileum, that will lead to vitamin B12 deficiency, right? So if you are a chronic metformin user, you need to consider this seriously. And obviously the side effects are fatigue due to anemia and numbness, and also tingling sensation in hands and feet. You can experience that. And also vitamin B12 deficiency anemia is the major side effects of major or common manifestation of metformin, chronic metformin use. And then metformin it actually also reduces hepatic glucose output, right? So it, if combined with insulin or other drugs like sulfonyl ureas, blood glucose can drop excessively, so that will lead to hypoglycemia. So yeah, you are a diabetic patient, there is increase in glucose, and this will lead to like metformin drug will lead to decrease in glucose output. And if that is severe enough when combined with other drugs, that will lead to hypoglycemia, and that gets manifested as dizziness. And also diaphoresis is excessive sweating, right? So that is a manifestation of hypoglycemia. You can also experience tremors or palpitations is actually you become aware of your own heartbeat. And the last side effect is altered gut flora and metabolic byproducts, and that will lead to like disturbances in taste, right? So that will lead to metallic taste in the mouth, obviously. This is the manifestation. And then altered appetite due to the taste alteration can also be experienced, right? So the suggestion box is that you have to take metformin with food, and then periodic B12 monitoring, blood sugar monitoring, and stay hydrated. So that will lead to like alleviation of common symptoms, but you will experience other symptoms also. So you have to be compliant in any ways. So subscribe for more clinical pulse, and thank you for staying with me. That is all for today.